Good day. I am a physician. Depression after 70 looks nothing like what most people expect it to. An estimated 16% of all adults over 70 are currently experiencing undiagnosed clinical depression right now. But unlike younger generations, they rarely cry, and they almost never report feeling sad to anyone around them. Instead, they feel exhausted, persistently irritable, and completely disconnected from the people they once loved and depended on. Because it looks nothing like depression at 30, doctors miss it, and millions of older adults suffer in silence. This video is for educational purposes only and does not replace professional medical advice from your doctor. The medical community has a devastating habit of treating every senior complaint as just another part of getting older. But losing your biological drive to live is not a normal part of aging. It is a lethal disease. Geriatric depression actively suppresses the immune system, dramatically skyrockets cardiovascular risk, and perfectly mimics the early signs of dementia. Thousands of patients are incorrectly medicated for dementia when the underlying cause is actually a fully treatable depression. Today we bring this hidden epidemic out of the shadows and into the clarity it has always deserved. We explore exactly how depression camouflages itself behind physical pain symptoms that appear entirely unrelated to mental health. We reveal the pill-free interventions proven by clinical trials to be as effective as standard pharmaceutical antidepressants. Number 7. How depression hides. In older adults, emotional distress often appears as unexplained physical pain and withdrawal. In older adults, emotional despair almost never presents as crying or openly expressing sadness to anyone nearby. Instead, the psychological distress violently manifests as physical pain in a well-documented phenomenon called somatic depression. You will hear endless, vague physical complaints, including agonizing back pain that imaging and scans cannot explain at all, brutal insomnia, relentless fatigue, total loss of appetite, and complete disinterest in food are the classic somatic symptoms. Families often mistake the severe focus loss and memory problems for the early tragic onset of Alzheimer's disease. When seniors withdraw from grandchildren or stop leaving the house, families blame it on their knees hurting instead. The disease perfectly camouflages itself behind the expected physical decline of aging, making it nearly invisible to untrained observers. The standard geriatric depression screening questionnaire asks about fatigue, appetite, and physical pain, not specifically about sadness. If you notice these physical patterns in an older loved one, depression must be formally investigated without further delay. Number 6. Why depression intensifies after 70. Blood pressure and cholesterol medications may contribute to depressive symptoms in some patients. The volume of emotional trauma accumulated by the age of 70 is staggering and almost uniquely difficult to process. It is a life era fundamentally defined by profound loss, the spouse who dies, the friends who disappear, the traumatic loss of physical independence due to chronic pain or a revoked driver's license is devastating psychologically. Retirement triggers a brutal identity crisis by stripping away a 40-year career and replacing it with purposeful emptiness. But there is also a hidden pharmacological trigger that most patients and families are never told about at all. Two of the most widely prescribed drug classes in geriatrics can chemically induce depression as a direct side effect. Beta blockers prescribed for blood pressure control are strongly associated with inducing depressive symptoms in elderly patients consistently. Statins prescribed for cholesterol management are linked to mood disturbances and depression in a clinically significant subset of users. If depression appeared after starting either medication, this connection must be discussed with your prescribing physician immediately without delay. Number 5. The serious connection. Research shows untreated geriatric depression is associated with increased overall mortality risk. We often view depression as a purely emotional issue, but in the geriatric population, it has significant health implications. Medical research reveals that leaving severe depression untreated in seniors is associated with increased overall mortality risk. The condition can trigger a sustained state of physiological stress that leads to elevated stress hormones in the body. This chronic stress state may suppress immune function and make seniors more vulnerable to infections. It can also contribute to systemic inflammation that may accelerate pre-existing cardiac and metabolic disease processes. This cascade can increase the risk of heart attack or stroke in the following years. Depression is not weakness. It is a measurable biochemical process with potential cardiovascular consequences. Untreated geriatric depression represents a serious health concern that warrants prompt medical attention. Early intervention in depression can help preserve quality of life and overall health in older adults. Number 4. Movement as medicine. 30 minutes of brisk walking 3 times per week may match pharmaceutical antidepressants in trials. If the disease is so fatal, the instinctive medical response is to immediately prescribe a pharmaceutical antidepressant. But geriatric psychiatrists now often prioritize a completely different first-line approach before reaching for the prescription pad. The groundbreaking SMILE clinical trial definitively proved that supervised walking is neurologically equivalent to standard pharmaceutical antidepressant treatment. The prescription in that trial was 30 minutes of brisk supervised walking performed exactly 3 times per week consistently. That simple movement protocol produced clinical outcomes statistically equal to standard pharmaceutical antidepressant medications in older adults. Movement physically forces the brain to release endorphins and brain-derived neurotrophic factor simultaneously on every single session. BDNF is the brain's most powerful growth hormone and physically rewires the neural circuits that depression had shut down. You do not need a gym membership, a trainer, or any equipment to deliver this neurological dose of medicine. A 30-minute outdoor walk 3 times per week is a clinically proven antidepressant prescription available free to everyone. If you find this science-based breakdown helpful, please click subscribe and tap the notification bell right now. It only takes 1 second, but ensures you never miss the next video in this series. Number 3. Morning light therapy. 30 minutes of morning sunlight may help the brain synthesize serotonin naturally. Beyond movement, there is an entirely free and universally accessible neurological treatment that most seniors completely and unknowingly ignore. It is the tactical daily use of morning sunlight applied before 10 o'clock in the morning consistently. As we age, our circadian rhythm naturally weakens, leading to fragmented sleep and severe daily mood instability. By stepping outside and exposing your retinas to bright natural sunlight for 30 minutes, you force a biological reset. The intense natural light completely halts melatonin production and forces the brain to synthesize massive amounts of serotonin. Serotonin is the exact key neurotransmitter that modern pharmaceutical antidepressants are specifically engineered to keep elevated in your system. You are essentially triggering the same neurochemical effect as an antidepressant drug using nothing but freely available natural light. Bright light therapy devices are available for indoor use in climates where outdoor morning sunlight is seasonally inaccessible. Morning light exposure combined with physical movement creates a neurochemical environment nearly identical to a pharmaceutical antidepressant intervention. We know movement and morning light can chemically alter the brain and reduce depression as effectively as medication. But what happens when the chemistry improves yet the soul remains empty from profound loss of meaning and purpose? Number 2. Purpose over pills. Addressing the profound sense of feeling useless and socially unnecessary requires meaningful engagement. You cannot medically medicate away the grief of feeling completely invisible and unnecessary to everyone around you. When the career ends and the children have moved away, the devastating void must be intentionally filled with structure. Psychologists call this approach social prescription, and decades of mental health research provide powerful evidence for its effectiveness. Older adults who engage in structured demanding activities demonstrate massive sustained drops in clinical depression measurements over time. Teaching a skill, mentoring younger generations, committing to a consistent volunteer schedule, or writing detailed family memoirs all qualify. These activities share one essential neurological ingredient, which is that they create a mandatory and externally verified daily purpose. Human beings are biologically hardwired to contribute to their social group, and this drive does not disappear at 70. When you give an older adult a genuine reason to wake up in the morning, you restore their armor. Social prescription is not a soft alternative to real medicine. It is real medicine with robust clinical outcome data. Number 1. Breaking the silence. The family's responsibility is to notice the behavioral changes and start the conversation directly. The greatest barrier to treating this epidemic is the toxic generational stigma surrounding mental health after age 70. This generation was raised to believe that acknowledging depression was a shameful sign of fundamental personal character weakness. They will almost never bring it up to their doctor unprompted, regardless of how severe their suffering becomes internally. The absolute responsibility falls directly on the family to notice the behavioral changes and break the silence compassionately. Do not ask them directly whether they are depressed because that framing will trigger an immediate defensive denial. Change the dialogue to focus on specific observable behaviors you have noticed changing over the past weeks or months. Sit down and say that you have noticed they seem very different from the energetic person you remember. Say that they seem exhausted and withdrawn and that you care deeply and want to understand what is happening. That one non-judgmental conversation initiated by you today could be the intervention that saves a life you love. Geriatric depression is often overlooked because it can present as arthritis, dementia, or simply the typical process of getting older. But beneath the physical complaints is genuine suffering that is highly treatable and deserves medical attention. If you recognized yourself or someone you love in this description, consider taking action soon. Take them for a 30-minute walk in the morning sunlight this week as a starting point. Ask their doctor to review all current medications for known mood-related side effects at the next appointment. Give them a structured, meaningful task that demonstrates they are valued and needed. Share this video with your family because you might be the person who helps them find support. Subscribe, tap like, drop a comment below, and share this video with someone you love.